Obviously, over the age of 50, if you have a strong family history of colon polyps, colon cancer, family history of inflammatory bowel disease, a personal history of colon polyps, or a personal history of inflammatory bowel disease, those are the general category. Since the 1990s, we've essentially have doubled. So in the last 30 years or so, we have doubled in the annual prevalence of those under the age of 50 developing colon cancer, and it is a little perplexing. The trend, if you look at the epidemiology of obesity in this country as well as around the world, is rising in younger people. The invention of very convenience technology has essentially made people, not as active. The foods that they've shown that nutritional-wise, that the consumption of these types of food that I've mentioned earlier, like the processed, the red meat, and the decrease in the fruits and vegetables, there is a trend in that in young people, and so that is the assumption right now. Obviously, there's a lot of work ahead to prove this, and obviously, anytime you see cancer in young people, you think about genetics, and is there a component to that, which is a little bit harder to prove, and that takes a much longer time to study. A strong family history, whether that history is inflammatory bowel disease, colon polyps, or colon cancer. In addition, there's a lot of evidence to suggest that those who live a sedentary lifestyle, have a high diet in processed meat, high in fat, low in fruits and vegetables, do put you at a higher risk to develop colon cancer. So what consists a strong family history? By definition, is usually a first degree. It's essentially, you can't truly count your grandparents or uncles, but like a siblings, mom or dad, those counts. The data show is that those that have a family history of colon cancer are at about 2 to 2.5-fold increase in developing colon cancer in their lifetime as compared to someone who do not have that history. Unfortunately, it's one of these diseases that often don't present with too many symptoms that people assume a cancer would present with. The more common signs would be rectal bleeding, changes in the bowel habit, obviously weight loss, abdominal pain, and the abdominal pain where a lot of time when I tell patients they have this, it's like, well, I've never had any symptoms, it never hurt. It's often associated, your common person out there associate cancer with pain, but it's less likely that they will present with pain into a much advanced stage. And so in general, oftentimes they have no symptoms. For the longest time, age 50, if you turn 50, you should get a screening modality, whether it is a stool DNA test or a colonoscopy, and we could elaborate on what is a better test, but I don't think that is, they need to get some sort of screening and age appropriate. And I will elaborate that more recently because of the trend of rise in colon cancer that is found in adults less than the age of 50. A lot of the societies have recommend, and with the latest society, which is the U.S. Preventive Task Force, have come out within the last year or so to recommend screening for colon cancer in those at the age of 45 and not at 50 as in years past. Beyond that, what can you do as an individual in your daily lifestyle to prevent that? Obviously, you can't change your genetics. That is what it is, but you can certainly change your environment, which is, be active, decrease in consumption of processed food, eat more wholesome foods, decrease in red meat intake, increase in fruits and vegetables, and those are the things that you can do to decrease your risk for developing colon cancer. there are a lot of test modalities out there. Again, there are, more recently that's become very, very popular because the patient really don't have to do anything, which is the stool test. That the patient essentially just send it off and it gets tested. And that has some utility, but in comparison to a colonoscopy, it is not the same. And someone, I was at a conference and someone put it this way, and I'll share this analogy. Let's just say you're in a car going down the road at, 70 miles an hour, down the highway, 70 miles an hour. And that, very close to you is a brick wall in the middle of the road. And that brick wall is colon cancer. The stool test is essentially the seatbelt. So the stool test will not prevent you from hitting that brick wall. The colonoscopy is the brakes in the car, and that's the analogy. The colonoscopy can prevent you from developing colon cancer. And the reason why is that in addition to detecting, polyp, we can remove it. And that's the key here is that colon cancer oftentimes do not become cancer from nothing. It usually starts from a colon polyp. And over time, these pre-cancerous polyp will then develop into a cancer if not removed. And colonoscopy detects it and remove it all in the same time.